Greetings. My name is Dr. Gene Marshall. I am a Chief Medical Officer for a multi-hospital healthcare system. I have a lot on my mind. Overcrowding, waits for testing, nursing shortage, sicker patients, electronic health record issues, and shrinking reimbursements. But one thing has me completely befuddled. After years of trying to improve our patient safety ratings and hospital reputations, we have spent millions of dollars. And our dedicated employees have spent thousands of hours doing process improvement work. But are any of our patients in any of our hospitals any safer now than they were a few years ago? Are we the only ones who cannot get their arms around the challenges of creating meaningful improvements in patient safety outcomes? The headline from a U.S. Senate hearing in July 2014 included the astounding report that at least 400,000 people died each year from unsafe health care. In spite of us knowing that patient safety is an issue, medical errors remain the number 3 killer in the United States.
We've known this since the first Institute of Medicine report was published, yet safety issues remain third only to heart disease and cancer as a cause of death.
After years of supporting healthcare reform, not only are people still dying from less than ideal medical care,
but continued unsafe healthcare delivery is costing our taxpayers over $1 trillion per year.
The problem is not the lack of data, there's lots of it, but the multiple sources are not typically aggregated and reconciled into something understandable. The problem is a complete lack of meaningful information. It's no wonder that systems cannot make measurable improvements in their safety performance. Industries outside of healthcare, such as nuclear power, communications, space travel, airline and air traffic control, and bridge engineering all recognize that readily visible events are only the tip of the iceberg. Meaningful system improvement requires measuring and understanding the events that occur beneath the surface. Remember the Titanic? The captain steered clear from the tip of the iceberg, that he could see. But it was what lay beneath the surface of the water that ultimately led to disaster. At the surface are many familiar issues. However, the data variables are rarely integrated to tell a single story of safety. There are tools we can use to deal with this. The Global Trigger Tool, surveillance for missed or delayed diagnosis, multidisciplinary mortality review, and surveillance for inadequate palliative care. These tools can identify the magnitude of events that occur in areas that are not quite so visible. Examples of these events include missed or delayed diagnosis of sepsis, failure to rescue a patient from acute physiologic deterioration, inappropriate antibiotic selection for a healthcare-associated infection, oxygen titration in a patient with baseline CO2 retention, or poor pain control in a hospice patient. If all of this information is aggregated, then a full and meaningful picture of healthcare safety will follow. At Brandix i3 Healthcare, we will combine the existing tools for identifying the adverse events not only at the tip of the iceberg, but those that lie beneath the surface, with new tools created for the sole purpose of identifying, measuring, and reducing harmful care delivery. But what if a patient has multiple events, identified in different data sources? Bringing all data together allows us to tell the full story of what happened under our care. And what if a patient transfers from one hospital to another, and later it's found that they had events in both hospitals? This patient safety iceberg suite will aggregate and reconcile data to tell the patient's story of their entire journey. At Brandix i3, while you are doing the meaningful work, we will give you understandable data, identifiable events, and clear indications of improvable processes of care. At Brandix i3, reducing harm is what we are all about.